Good afternoon, everyone. We're going to get started in just a few moments to give other folks an opportunity to come and join. So we'll be back just shortly. Good afternoon, everyone. I'm JB Banks, Dean of Students. I'll be moderating today's call. Some quick housekeeping items before we get started. All attendees' lines will be muted throughout the call. When we get to Q&A, place your questions in the Q&A function at the bottom of your screen. We will do our best to get to all questions. If we do not get to your question, you can reach us at the colorado.edu/COVID-19 website. And as a reminder, today's call will be recorded. This recording will be added to our COVID-19 website. On today's call, we have Pat O'Rourke, Interim Chief Operating Officer, Russ Moore, Provost, Jeff Zayak, Executive Director with Boulder County Public Health, and we're also joined by Katrina Spencer, Associate Vice Chancellor for Budget and Finance, Sarah Huntley, Director of Communication and Engagement with the City of Boulder, and Dr. Chris Urbina, Medical Officer with Boulder County Public Health. I'll now turn it over to Pat O'Rourke for some opening comments. Pat?
Thank you, JB, and thank you to everybody for being with us today. Wanted to encourage everybody to, if you haven't voted already, to please do that. It's an important part of the democratic process, and we want to make sure that we're doing that at CU Boulder. Wanted to start today by following up on some of our discussions about COVID over the last several weeks. What we know is that during a period of time earlier in the fall, CU had an outbreak of cases, and we did a really good job of being able to address those, to be able to change the behaviors that were leading to the outbreak in our community, and to try to effectuate change. We're now faced with a situation where, as Jeff Zayak from Boulder County Public Health is going to describe in a moment, the numbers in the county are rising generally, and we're seeing a rise in cases across all populations, but we're also seeing the number of cases in our CU community potentially go up again. Not as much as we saw before, but we reported 19 cases this morning through our surveillance testing, and that's not the direction that we want to head. What I wanted to talk first about is what occurred over the weekend. Our Boulder CUPD officers joined Boulder Police in patrolling the hill west of campus, and over the weekend made contact with about 20 parties after 5 p.m. on Halloween night. Boulder Police issued 6 public health order violation citations. CUPD issued 2 public health order violations, and there were 16 noise disturbance complaints issued in the residential areas around Boulder. What I want to say is this is not acceptable. We've made very clear to our student body that they need to be following the county public health directives under our student code of conduct. And I'd like to thank those students who have followed those directives. But what we saw over the weekend is not okay. We know that gatherings, in particular social gatherings, and those of the type that we are hearing about involving some of our students, those contribute to the spread of COVID in our community. They're not acceptable, and they're not something that we're going to be in a position where we're going to tolerate. Those cases that occurred over the weekend will be referred to our student conduct office. CU Boulder is responding quickly to the cases that are there, and we will take disciplinary action when we have to. The actions of those students who are engaged in unsafe behaviors are not only representing a threat to the health of the campus, they're representing a threat to the health of the community. And those students who are doing that are placing their own opportunity to continue with the University of Colorado Boulder at risk. We messaged to our student body about our expectations for safe Halloween conduct. We provided a slate of safe alternative on-campus activities. And those students who joined us in the efforts to be able to address what is occurring in our community, I can't tell you how much I appreciate it. And for those who didn't, we will continue to monitor their behavior and do what we can to be able to effectuate change. It's just something that we have to do. We're committed to providing safe educational and social experiences for our students. Parents, you've been our partners in that effort, and we want to thank you for what you've done in urging your students to comply with county health directives and our campus requirements. We're at a point now where if we don't continue to maintain our vigilance, we could end up in situations where we're losing control once again. And that's really what we don't want. As we get closer to the end of the fall semester, we're strongly recommending that all students, both on and off campus, get tested for COVID-19 before going home for fall break. Students can get tested. We want them to get tested. We need them to get tested 48 to 72 hours before they leave campus. This is important. We know as they're returning to their communities, as they're returning to their families, as they're going to see people who are in different age groups, we don't want them to expose people to COVID in their communities around Colorado or across the nation. We'll be testing all of our residence hall students through our outgoing monitoring program. And we're also focusing on getting all of our off-campus students to get tested at the University Memorial Center at the SEEK building on the East Campus. There's going to be a lot more detail about those testing availabilities. But for those parents who are in the call, please encourage your student to get tested before leaving for home. Also wanted to let everybody know that since yesterday, CU Boulder students, faculty, and staff have been receiving invitations to transition from what we've been using from our daily health questionnaire to what's being called the Buff Pass. The Buff Pass is designed to simplify and improve the health questionnaire experience. It's been tested by members of our campus community. It's confidential, mobile friendly, safe to use, and we really need people to use this resource. Our friends at Boulder County Public Health are going to talk to us in a few moments about the county and state health picture and the situation that we're in. But the overall message is this: we need all of our CU students, our faculty, our staff to do the right things. Avoid gatherings, wear masks, continue to be vigilant. We were really successful in being able to bend down the curve once. Now that the disease has more prevalence in the community, it's even more important that we do our part to be able to protect our campus and our neighbors. I'll hand it over now to Russ Moore to talk about the developments on the academic side and with the academic mission.
Thank you. Thank you, Pat. First, an announcement to students. Spring 2021 classes are now viewable in the Student CU Boulder class search, which means it's time for students to start planning their schedules. Students can make registration easier by addressing any holes, scheduling an advising appointment, and completing pre-registration items before their assigned enrollment dates. So please do that. If a student missed the enrollment dates email from the Office of the Registrar in mid-October, they can find that information regarding their assigned enrollment dates on the class registration guide in the Buff portal. When planning a spring 2021 class schedule, students keep the following revised academic dates in mind. The spring semester will start on Thursday, January 14. The first Friday, January 15, will follow a Wednesday schedule for all classes. Our campus is hosting 2 voting locations for elections today. The UMC Vote Center is open now, and an additional vote center is open at the Village Center in Williams Village. So to underscore what COO O'Rourke just said, please participate in this process. It's vital to our democracy. We've been engaged in a weeks-long effort called Your Vote Counts to get students to register and to vote, so we certainly hope they do. Chancellor DeStefano sent out a great message on this last week that many of you might have seen. If you haven't, please visit colorado.edu main web front and you can read all about our efforts regarding voting there. Elections in our nation's political division can add to the stress of students, and we realize that. Not only that, it can add to the stress of faculty and staff as well. I'll ask JB to give a rundown of the post-election discussions and resources that Student Affairs has made available for students in just a moment. But for faculty and staff, the Faculty and Staff Assistance Program, FSAP, is offering free virtual drop-in counseling support this week in the form of one-on-one virtual rooms. Drop-in counseling is helpful for employees looking to receive immediate and confidential mental health support. Again, please visit the Faculty Staff Assistance Program if you would like to avail yourself of those resources. And now I'd like to hand it over to Jeff Zayak for an update from Boulder County Public Health.
Hi, everyone. Thanks for joining us today. I'm going to go ahead and share my screen and go through the latest update in terms of where we're at right now. Bear with me for 1 second. So as you can see, our incidence rate is now climbing. This dial has, I understand, just been updated by the state, but it is of the same colors. And we were currently at Safer at Home 2, which is this middle dial. And we will now be at Safer at Home 3 based on our incidence and our positivity rate, which is climbing a little bit. So we do have a challenge. We are working to try to reduce our incidence rate, but we know that that's going to be a challenge, as I'll go through here in a second. You can see that our positivity rate is also increasing. A couple of weeks ago, it was down in the green. As Pat had mentioned, we've also seen increasing cases amongst all of our population. This is really the graph that illustrates the challenge, not just for us in Boulder County, but for the metro region, for other portions of the state. And we would see a similar graph to this if we looked at some of our surrounding states as well. And this is the challenge that's in front of all of us, especially as we go into the fall. This was us, Boulder County, at our highest outbreak with CU, and you can see that we have rates across the metro Denver that are significantly higher than where we were at our highest peak. So this is a pretty big challenge for the state. It's a pretty big challenge for each of these counties, and we're going to have to be extremely diligent moving forward. This is the graph of the University of Colorado outbreak, and you can see where we had a peak. And again, our students are doing the right things. As Pat mentioned, we are starting to see a little bit of upticks in students that are testing positive. We need you to remain diligent and to help us control the spread of this disease, which is now across our community. Our rate is up to 402 per 100,000 for our 18 to 22-year-olds. But as you're going to see in a second, that's consistent with where some of our other rates are at this point, because again, we're seeing increases across our generalized population. We're also seeing an increase in test positivity rate. So again, I think Pat did a good job of really emphasizing the need and importance for students to be diligent as we move forward. This is that busy graph, but here's the 18 to 22-year-olds, which has come significantly down and is now mixing with our other rate. The challenge here is that this is across all age groups, and we can see that all age groups are increasing at some level, some faster than others. And it's going to be critical that we all social distance, mask, and don't gather as we go into this holiday season. This is our 5-day rolling positivity rate in Boulder County, and the one on the dial that you saw is a 2-week. So this one is a little more responsive. Again, headed in the wrong direction, as you'll see here. We're above 5%, up to 6.1%, and that is a challenge for us as we move forward. Sounds like somebody might not be muted either on the phone. This is our hospitalizations in Boulder County for COVID-19. We were in a trough in the summertime, which is where we wanted to be. And now we are seeing an increasing rate. We were at 60 hospitalizations here. At our peak over here, we were at 68 in the previous, at the start of this disease. So we want to make sure we're driving this rate down. And in order to do that, we're going to have to see decreasing rates across our population. I'm going to show you where hospitalizations are currently occurring in terms of age groups here on this graph. So you can see that for 0 to 9, 10 to 19, and 20 to 29, we are not seeing many hospitalizations. And this is not Boulder County, this is statewide. And these are for COVID-19 hospital admissions. And what we are starting to see, though, is increases in age 30 and up. That is consistent with what we saw, as you can see here, in these previous peaks in the disease progression. And we're starting to see that happen again. So we really do need to pay attention. This impacts multiple age groups. We know that, and unless we get a control on those increasing cases across our population, we're going to end up with threatening and stressing our hospital situation, which we know then ends up in increased deaths. Our key takeaways are mostly what you just heard me talk about. One of the things that I wanted to highlight here is, again, the partnership between the City of Boulder, Boulder County, and the university, and how much I appreciate that we are working together. We do want to keep kids and our students in school, and in order to do that, we have to maintain these outbreaks at a low level so that we are not creating more issues, as you've heard me talk about and you've seen me illustrate here in this PowerPoint. We need to be diligent as we move forward. And this next bullet of 1 in 219 people is where I really wanted to focus. So this means we have a lot of virus in our community. If this was a couple months ago, we were somewhere around 1 in 800 people that were infectious, but we now have a lot more virus in our community circulating, which means it's a lot easier to spread. It's a lot easier to catch. It's much more, you're going to encounter people more frequently than you would have in the middle of the summertime that have the virus now. So it's really diligent that that we stay focused as we go into this fall time. You preferably no gatherings except for with your direct and immediate family, because we know that gatherings are spreading it. We know that people are getting COVID fatigue, and we know that this is really hard for people, and we don't want to lose hope. We know we can get through this. We will get to a place where we have a vaccine that's more available for our community at some point. But until we get there, we really need to maintain the social distancing, not gathering, really masking, and making sure that we're hand washing. And as Pat mentioned, it really does. It comes down to all of our individual behaviors as to where we go with this. Regardless of what kinds of things go in place, people that follow these prevention recommendations are going to help us drive down this disease, and the people that don't are going to help spread this disease. And it's as simple as that. We all have to take personal responsibility. We need to take it seriously because we're starting to see severe negative outcomes. And we'll be working with the state over the next week to determine what happens with Boulder County and where we'll end up. But we need to focus on really driving down our numbers at this point. That's all I have. I believe I'm turning it back over to JB at this point.
Thank you again, Pat, Russ, and Jeff, for your remarks and for your time today. As Russ shared, the Division of Student Affairs is creating opportunities for students to engage in dialogue support resources after the election. Some of those include student conduct and conflict resolution. We'll be hosting post-election dialogue sessions this month to bring students together and discuss the impacts of the election. The Center for Student Involvement has resources for students on voting and democratic engagement. There will be a post-election community chat hosted by our colleagues in the Center for Inclusion and Social Change and Counseling and Psychiatric Services on Wednesday, November 4th from 10 a.m. to 5 p.m. This event provides a virtual space for students to process, practice self-care, and more. Health and Wellness Services is offering a variety of election resources for students to help students focus on managing their stress, including Let's Talk sessions, guided mediations, and more. Finally, our faculty and staff assistance is offering free virtual drop-in counseling support this week in the form of one-on-one virtual rooms. Drop-in counseling is helpful for employees looking to receive immediate and confidential mental health support during election week. As Pat mentioned, there were some citations for student gatherings over the past weekend. But I would like to reiterate my thank you to the majority of our students who are following the protocols, who stayed home last weekend or hung out with small groups and took the proper precautions to keep our community safe. I want to say thank you. You are making a difference and we appreciate you very much. In addition to election events, we have other great opportunities available to our students in the coming weeks. For example, our student involvement is offering DIY nights tomorrow where students can get the supplies and create a number of opportunities. CSI is also offering a grab and go event for those interested to come get supplies to write cards of gratitude to our veterans in preparation for Veterans Day. Now I would like to open it up for some Q&A. If you have a question, please feel free to enter it into our Q&A function at the bottom of your screen. We are prioritizing questions from students and families. So let's go to our questions. The first question is for Russ. Will the spring class schedule indicate whether classes are being offered in person or remote so that students can register for the types of classes they want?
Yes, they will. So they should be able to discern that from looking at the course scheduling.
Thank you, Russ. This question is for Pat. There seem to be fewer monitoring and PCR tests being conducted now as compared to weeks ago. Are on-campus students still required to complete weekly monitoring tests?
Yes. So on-campus students are still required to complete weekly on-campus testing. And like I talked about earlier, we also have testing available for off-campus students, faculty, and staff. The number of PCR tests have gone down because we normally use the PCR test as a means of confirmation when the surveillance tests have come back indicating somebody may have COVID infection. So as we've been more successful in being able to bend the infection line down, that's less demand for the PCR tests. So that's not necessarily a bad thing. But we do want more students, faculty, and staff to take advantage of the testing capabilities. We've had some drop off because we've had some students who left campus when the COVID-19 spiked. And then we also had some students who tested positive so that they were taken out of the testing protocols for a while, but that we want to drive up those numbers. So parents, please ask your students to get tested, and any students, please get yourself tested. Students who do get tested can win gift cards and other types of promotions. So do it.
Thank you, Pat. And it looks like this question again is for you, Pat. During CU's outbreak, my son got COVID. I understand that while he is not contagious at this time, the virus may still be in his body. Therefore, I understand why he needs to wait 90 days to be tested again. However, when he returns home at Thanksgiving, our state requires that he be tested. Can he receive official documentation from CU noting the date he acquired COVID?
Yes. So wherever he was tested, the medical provider or clinic can provide him with documentation demonstrating that he was COVID positive but has recovered, so that would enable him to be able to travel safely.
Thank you, Pat. And this question is for me.
JB, I think Dr. Urbina had a follow-up there.
Okay, go ahead. Absolutely.
So JB, it'd be helpful, Patrick, if I can just add a few words to what you said. After 10 days, if a student or staff or anybody tests positive for the infection and recovers from the infection, they're essentially released after 10 days of isolation with decreasing symptoms and no fever. So he is no longer contagious. So he should be able to safely travel. He may test positive up to 90 days because the test is so sensitive. You can still have viral particles that you can test, but you're no longer infectious. I hope that helps.
Thank you, Dr. Urbina. This next question is for me. Is there a specific day students should get tested prior to leaving for Thanksgiving? And the answer is there's not a specific day. What we're working on is actually making sure that students get tested at least 2 to 3 days prior to their departure. This next question is for you, Russ. What are you hearing from faculty about their abilities to teach online? And do you expect that CU Boulder will offer more online options moving forward?
Yes, actually we do. So we've been pretty pleased by the response of our faculty in deploying courses online and remotely. And the faculty are keenly aware and they have resources to provide, I think, a better opportunity for students to participate in their curricular endeavors online. We're also providing a lot of in-person courses, at least that's what appears to be the case at this time. For the spring. And as for the future of online at CU, just this summer, the Board of Regents approved some new online graduate degrees. So I also expect not only will some of our existing courses be available online, but we're actually expanding the offerings to our students. And in this case, the four newly approved courses are graduate courses. But we do have many undergraduate offerings as well.
Thank you, Russ. This question is for Pat. What happens if a student living on campus tests positive before leaving for break? Will they be able to stay on campus? Will isolation facilities and food delivery be available through Thanksgiving? We will work through them? Oh yeah, that's the question. I'm sorry. Available through Thanksgiving.
Yes. So if a student tests positive for the on-campus student population, we will definitely have support for them. There will be the opportunity for them to be able to stay with us. We'll make sure that they have their housing and food needs met. And so that's not a concern. And we don't want them to travel, obviously, if they've tested positive. What we do know is that before, when we had the spike in cases, that CDPHE, and Boulder County Public Health had issued some guidance that would allow students to travel by car without making any stops within Colorado, but that especially those students who, if they test positive, shouldn't be traveling by air, should be not contributing to the spread of the disease. And we will be here to support them and make sure that they're taken care of if they can't travel.
Thank you, Pat. This question is for Russ. How will the change from Safer at Home Level 2 to Level 3 affect the operations of the university? More specifically, will this affect the operation of in-person classes, rec operations, and events?
So we don't anticipate that it should significantly affect our in-person class operations. Our ability to deliver curricula in the classroom has proven to be very, very safe this fall. So working with guidance, of course, from Boulder County Public Health, we anticipate being able to continue to deliver our on-campus offerings for in-person classes. With regard to the impact of if we were to move to level 3 on other operations on the campus, actually, I would defer that answer to Pat.
Okay, Pat?
So if Boulder County moved to level 3, that would not impact our ability to continue to operate the residence halls. It would not impact our ability to have students to be able to participate in their in-person educational activities. What it would affect is we've been trying to create social opportunities on campus, and we may have to limit those. It would also have some impact on some of the events that we have. But where you're going to see more of the impact is in the bigger, broader Boulder community in terms of the effect that it has on those businesses that offer personal services, restaurants, other types of gatherings. And so we're preparing that if there is a change in status, that we'll have to adjust our operations, and we want to maintain the campus as safely as possible. But that we think that we'll be able to do that and support our student needs.
Thank you,
Hey,
Pat.
BJ, can I jump in for a second too?
Yeah, by all means.
Thanks, because I saw two questions about, are we in level 3? And no, we are not in level 3. We're trying to prevent ourselves from moving to level 3. And obviously that's going to be a challenge, as you saw from the data. So it's going to take all of us, like I said, to make changes to be able to not go into that level. So I just want to clarify that we are not in level 3.
Thank you, Jeff, for that clarification. This question is for me. Can you do more about the students that partied for Halloween? Currently, we are collecting reports from Boulder County Boulder Police Department. We're seeing reports, and as we review those reports, we are issuing interim suspensions, interim exclusions. We're working very closely with our partners. We're working with the Hill community. So we're doing quite a bit to make sure that we hold students accountable, as was mentioned earlier. Pat mentioned how disappointed we were with those students who partied. It is certainly not what we're about, and we're going to do all we can to rectify the situation. This next question is for Pat. Can you address the number of people that are allowed to attend football games? Would the total number of attendees change if we move to Safer at Home Level 3?
So thank you, JB. And I apologize. I'm in a place where there's some background music. So if that comes through, I'm not my fault. But wanted to answer the question about attendance in football games. The football game itself against UCLA this weekend would be very sparsely attended. Under the Pac-12 guidelines and the protocols that were approved by Boulder County Public Health, the attendance at the game is really limited to the immediate family members of the players. That means that in Folsom Field, which has a capacity of more than 53,000 people, the total attendance at the game will be less than 1,000. What we know, though, is that this could also provide an opportunity where people might otherwise wanted to have tailgated around the stadium. We're not going to allow that to happen. That's a potential transmission vector. We need people to be safe during this period of time. And we're actually asking all of the Buff fans out there to please support the team but do it at home. Watch the game, support the Buffs. Don't throw parties. Don't bring people together. That's exactly the type of gathering that Jeff Sayak mentioned earlier. Even gatherings of 10, 12, 15 people can serve as an opportunity for disease to spread. And so right now, during this critical time, please don't use the fact that we're having a football game be a reason why we're creating more cases in the community. The team values your support, but not at the expense of the safety of our community and of our campus.
Thank you, Pat. Russ, this question is for you. Understanding that Friday was the last day to drop a class, request grade replacement, and change pass fail status, what should students do if they are struggling?
So my first line advice would be to make sure that they connect with their advisors, and that they also connect with any academic support resources that we have on campus, which are many. And certainly, if they're having trouble, contact their professors or their instructors to provide guidance in terms of the kind of support that students can get. And again, I would really highly recommend that they do this immediately, if not sooner, so that we can make sure that all of our students are successful and that they have a very successful completion of the semester.
Thank you, Russ. Looks like this question is for me. If a student has violated public safety rules, etc., and has citations, and the student is over 18, would the student's parents be notified? And the answer is no, not necessarily. What happens is the student is notified of the violation, and we expect our students to sort of work with the issues and concerns. Certainly, if there is a FERPA release on campus, we can share information with parents, and that's the protocol that we've been following. All right, this next question is for Pat. What preparations, if any, is CU making for potential post-election protests on campus?
So thanks for the question. One of the things that we recognize at the University of Colorado is that people have a right to freedom of expression, and that freedom of expression can include the right to protest. So what we have is we have our teams that know that we need to balance two things. Number one is the ability of our students and others to have a voice with the ability for us to be able to maintain campus safety. And so our significant events team, as well as others, are going to be monitoring the campus condition, trying to make sure that we're recognizing the ability of people to be able to peacefully protest and also to be able to keep the campus safe. We also know that the City of Boulder and the other law enforcement agencies throughout the community are also preparing in case there are any type of protests that are unsafe, so that they can be able to do what they need to do to protect the community. But our teams and those people within student affairs and elsewhere have done a really wonderful job of being able to communicate with the students about the need for us to be able to participate in democracy, to do it in a way that is constructive, to do so in a way that gives voice to our values, and not to do it in a way that would give rise to a condition of unsafetiness or disturbance on the campus. And so we're hopeful that things go well this evening.
Thank you, Pat. We're going to stay with you on this next question. I believe you responded to it already. Regarding football, will tailgating be allowed on campus grounds?
The short answer is absolutely not. Tailgating is the quintessential activity where people would be moving from place to place, not observing those type of small group limitations, and would be absolutely vector for disease transmission. So I know it's a disappointment to folks, but tailgating is something that is absolutely not something we can allow this fall.
Thank you, Pat. This question is for Dr. Mina. Is it reasonable for out-of-state students living off campus to plan to travel home for Thanksgiving and winter break and return to Boulder in January?
That's a great question. Obviously that's a personal call. I think that as long as people are taking safe precautions, they get tested before they leave to make sure they're not spreading the infection back home, and consider getting tested. And I'm not sure what the requirements will be for CU coming back to campus, but I would assume that you would probably recommend, Patrick, that they get tested before they come back to campus. But I think if they take precautions on either side, whether or not they're living in Boulder or they're living in whatever community they go on, this virus is affecting all of us. And so they're going to potentially get either exposed or can spread the disease wherever they are. So it's the same precautions as they are in Boulder of using masks, washing their hands, social distancing or physical distancing greater than 6 feet, avoiding large groups. Wherever they are, if they practice those activities, they will be as safe as they possibly can.
I follow up, JB.
Yes.
So I appreciate Dr. Urbina's answer, and he's right on point, which is if people travel home after the next few weeks and then they are going to return in January, we would want them to get a COVID test before they travel, just to make sure they can do it safely, and that we will be requiring for students before they would move back into residence halls that they undergo testing to be able to demonstrate a negative result. And we're also I'm gonna keep saying it because I want people to take advantage of it. We're going to have testing available for our off-campus students. Get that testing done so that you know what you're doing, and that you're in a position where you can feel comfortable traveling both to the campus and from the campus, because that's our best means of being able to detect early and to try to keep the transmission rates low.
Thank you, Pat. Jeff, is it Boulder County Public Health strategy to stay locked down until a vaccine is available?
Hi, JB, thanks. And the strategy that we're going to need to use until we have a vaccine is clearly that personal responsibility, because when we look back at the history of this, each time we've seen points where there's large gatherings that occur, and I'm going to just use two examples. I'm going to use the July 4th weekend, and I'm going to use Labor Day weekend. We see that the events of disease spread occur around those times because we know that people are gathering. We know that's part of where this spread is coming from, is when people are getting into personal gatherings, they're letting down their guards, they're not using masks, and they're not effectively social distancing or hand washing. And as a result, we see spread occur. It's pretty well documented. You can see it in the graphs over time. And it's going to be up to all of us, again, to take responsibility to do those things until we get a vaccine. And then just to clarify, because I saw another comment about on the website as well, I want to share this one slide real quickly again with all of you, because I think it's important to illustrate.
And Jeff, can I talk about the vaccine a little bit after you're
Absolutely, yeah. I just want to, again, when we look at this graph, our incidence rate at 295.9 is in level 3 right now. Our positivity rate is in level 2, and our protect our neighbor for 10 days increasing or stable hospitalizations is in protect our neighbor level green. And what happens when we get into this situation, I think I've explained this the past weeks, but I just want to make sure it's clear because I'm seeing some confusion in the comments, is that we then are required to put a mitigation plan forward to the state to let the state know how we plan to try to reduce these numbers. At some point, the state will move us if we cannot reduce our numbers. And we've seen that happen with other counties across the state now, as you've probably seen in the press. But I just want to, again, illustrate that when we were presenting to you a week ago, we were not in this level. These rates are increasing. It's a challenge for us. It's going to come down to all of us being able to really have control on this virus and stop this spread. And then Chris, I'll turn it back over to you to add anything you want about the vaccine.
This is a very common question now as we get closer to the end of the year. People are very hopeful for the vaccine. We all are. And I think that we're likely to see some early results by the end of 2020. But those vaccines will be available likely for first responders, healthcare personnel, probably the most vulnerable populations, but not readily available for the general population, probably till mid next year or probably the fall of next year. But let me point out one thing. We don't know how effective the vaccine will be. And we don't know how long it will last, so that whether or not it will protect you for a long period of time. And the final thing is we don't know how many people will wanting to take it. Right now, the flu vaccine, only about less than 50% of people take the available flu vaccine. So that regardless of whether or not it's effective or as good as we hope it's going to be, and if as many people as take it, we're still going to have to use some of the similar precautions that we've all, Patrick, UJB, I and Jeff Zak have talked about. It's the same precautions because we're not going to be totally able to eliminate the eliminate the virus with the vaccine alone. So we'll still have to use the same prevention strategies as well.
Thank you, Dr. Avina. This question is for Russ. My sophomore son said that all of the spring classes he needs will be done online in the College of Engineering. All of his classes were online this semester. Is there any chance that spring classes marked as online now will later move to in-person?
That's a great question, and I might need to get back to you with the definitive answer on that. I think in all likelihood, those classes that are showing up as being delivered online will be delivered online. I can't speak to whether or not that we'll be having more in-person classes. What I can tell you that we're finalizing, it's not all cast in stone. We're currently finalizing the modalities. I'll certainly deliver that message to the College of Engineering to make sure that as much as possible, we can provide some in-person offerings as well. So the spring schedule is pretty close to being completed, but it's still in play, and we'll have that locked down very, very soon.
Thank you, Russ. This one is for Pat. Pat, will students be required to have a negative COVID test within 72 hours of moving back in dorms in January? Will there be another $100 incentive?
So we will continue with incentives into the spring in order to make sure that people get tested. And we're going to be doing two things. As I described earlier, we're going to have a recent COVID test or a test upon move-in as a requirement for returning to the residence halls. And then right after students move back into the residence halls, we are going to continue with our normal cadence of weekly testing. That gives us the ability to be able to look for infection early in the dormitories. We use that as well as the wastewater testing to try to get a picture of the COVID burden in the campus population. And so fully expect those to continue in the spring.
Thank you, Pat. This question is for me. Who can we speak with to address food services issues? And then the other part of that, CU continues to state the food will get better as the semester goes on. Certainly you could reach out to me, my colleagues. Certainly we'll do all that we can to address any concerns around food and dining. And so me as the Dean of Students, I'm concerned about all issues, all concerns related to students. I'd be happy to entertain whatever thoughts, questions you might have, and be able to convey that to my colleagues in student affairs. This next question is for Pat. And this is regarding the football ticket lottery system. Our enrolled students are able to participate too.
So no, there is not a football ticket lottery. Under the Pac-12 guidelines, the only spectators that are allowed are of the immediate family members of the student athletes. There will be no general spectators at the football games, and we know that's disappointing, but that's the rules that we have to contend with for the foreseeable future.
Pat? This question is for Russ or Catherine. No prerequisites for any courses are listed for the spring 2021 class schedule. Is it still being updated?
Yeah, we've actually, since we saw this question first in the chat, we actually went back to the registrar and did a random sample. So looks like a good number of courses do show prerequisites, but I do want to thank the questioner for raising this issue. Maybe if you could provide a little more specifics, we could zero in on it. There may be a few glitches in here, but our initial assessment is that not all of them are absent prereqs. In fact, most of the samples that we've looked at do contain the prereqs. So thank you for that. And again, perhaps in the chat or email me or at vcaa@colorado.edu, we can get to the bottom of that.
Thank you, Russ. This question is for Jeff. If parties on the Hill are ongoing, why are CU cases among 18 to 22-year-olds not spiking again, any more than they are among 35 to 44-year-olds?
So they are going back up as I showed in that little graph, but it's not outside of the norm at this point with those other populations. As you can see, we started to see a few more students testing positive on the graph that I showed you earlier, and we want to keep that to a minimum. So I again want to thank our students. I think that what's happening is the majority of our students are following the guidelines. They're doing the right thing. They're taking responsibility. And we don't want the small number of students that are not to blow that up. And that can happen if we have too much spread occurring. So we really do need to really focus on making sure that those parties are not occurring on the Hill. And again, that comes down to personal responsibility.
JB, can I follow in on that?
Absolutely.
Which is the number of cases trails behind the activity. So as Jeff described earlier, we saw cases coming in after the 4th of July. We saw cases coming in after Labor Day weekend. The fact that we had our cases go down for a period of time doesn't mean that we can let our guard down. It doesn't mean that it's an opportunity to be able to say, we can go back and have those type of parties. My guess, and we'll know this soon enough, is that we will see a spike in cases after the parties we saw this weekend. And so the fact that our numbers are down is really great. And I'm really proud of the students who helped us get those numbers down, but we can't confuse having numbers going down with meaning that we're out of the woods, because we're certainly not out of the woods. And right now, with the overall disease burden within the community, it's more important than ever that the CU students be part of the solution. It's the right thing to do, and please help us.
Thank you, Pat. And I'll go ahead and give this one to Russ. What percentage of spring classes do you anticipate will be set up in outdoor classrooms?
Great question, and we don't anticipate any outdoor classrooms will be constructed for a number of reasons. First of all, there are some issues with outdoor classrooms regarding acoustics. In particular, for spring semester, weather will be a significant challenge. But furthermore, I want to provide everyone with assurance of the remarkable job that our facilities folks have done with respect to retrofitting many of our classrooms with upgraded filtration systems and HVAC systems. Minimally, any classroom in which we teach courses has an air exchange of at least 3 times per hour. Many times it's far in excess of that. And using our social distancing and masking protocols, to date, we have no evidence of any transmission of the virus in a classroom environment. So we're very, very confident based on best practices, world-class aerosol experts, and remarkable facilities and HVAC people who've come in basically to make all of our classrooms comparable to an outdoor environment. So we feel very good about that. And again, the data that we've acquired so far this fall semester underscores our assertion that our classrooms are very, very effective in mitigating the transmission of the virus, since we haven't seen evidence of that to date.
Thank you, Russ. This question is for Pat. Is CU Boulder still continuing to do wastewater testing?
We absolutely are. And it's been both a fascinating and interesting ride to be able to see. One of the things that we know is that COVID appears in the wastewater. So that's one of our early detection systems. If we know that the wastewater is showing us the presence of COVID in a dorm in an increased number, then we can target messaging to the students in that dorm, asking them to speed up their going and getting tested, and we can target our testing efforts. So it's been a really great tool, and our scientists who made that possible have helped us tremendously.
Thank you, Pat. And final question is for me. Thank you for addressing the food issue question. How do we reach out to you? And you can email me at deanofstudents@colorado.edu. Again, deanofstudents@colorado.edu. Thank you all for the call today. As always, we appreciate it. If you have any further questions, please visit colorado.edu/COVID-19. We provide twice a week updates, 10 a.m. Thursdays with the city and county, and Tuesdays at noon. You can also give us feedback by visiting our COVID-19 website at www.colorado.edu/COVID-19. Please vote. And again, go Buffs.